To ask you about the philanthropy gap, because I wasn't even aware of that. Tell us about that.
Well, I think people people who gift money, who are in philanthropy, first of all, I don't think they understand the sort of size of the issue, and you know that's probably true for many people in society. It's not particularly true of them, but if most of us don't know these issues, why would they also? So that's one thing. And then I think the other thing is that they see it as a kind of never-ending problem, which actually it's not. Many people in our programs, and I'm sure Pamela can testify this to her own experience as well with programs in the United States, for example. Many people get better and improve enormously with the current treatments that we have, and we shouldn't forget that. And so actually, although we started this particular meeting with some of the difficulties that we're facing, and they are real difficulties, there's also a message of hope, which is that actually if we apply what we know and what we're learning now with a much more rigorous base that Pamela's emphasizing, we will be able to make great progress, and we need that funded both speculatively in the sense of trying out trials and pilot studies and so on and so forth, and also major programming, because in my view, the weakness in this field is as much about major programming as it is about anything else. There is still a dearth of organizations that, for example, would like to work in the same space that we inhabit. There are only at the moment something between 5 and 6 international agencies who have major specialisms in mental health. There are lots of local agencies, of course, in country, that goes without saying. But it's still a very under-resourced field, both in terms of the manpower and in terms of the money.